from Croaky, here with an old Periscope favourite, Michael Moore from the Public Health Association of Australia. You've been at the ALP Health Summit today. What did you take away from it?
Look, it's really interesting. We don't expect to see change happen immediately. If I go back 3 years, rather than having a summit, Catherine King had basically called people in a few at a time and talked to them. And we had actually made quite an impact on the policies that they took to the election, which were probably the best policies we'd ever seen on preventive health. So I think that was really worthwhile. And this bigger exercise, I think, is really important. And those of us who work in public health generally know we don't get things like that. We do wait years to get change, and there's a lot of reasons behind that. I think, though, today the message was very, very clear and very sharp around equity, and very clear that this has to be tackled in a very, very serious way. In health terms, we call it social determinants of health. But what we're really interested in is fairness, and our system's not providing that.
I agree with you on that, because I think you and I were possibly in the same sessions. The difficulty was, of course, everyone could only really go to two, and there were their pointy end ones on hospitals and other issues. Do you think that message got through there too, or is that where the barriers are?
No, I think it's also true in hospital, in GP training, wherever we were talking, in GP land. Wherever we were talking, there is still the situation where the wealthier you are, the healthier you are, and that's where your treatment operates. Look, there was a specific example about Aboriginal people who go into emergency, and even with the same problems as non-Aboriginal people, have not had the same treatment, and the importance of cultural understanding. So there was a range of issues. But look, in the fundamentals about the health policy, about prevention, about ensuring that we see a significant increase from our current 1.5% of funding back up to at least where Tony Abbott had it when he was Health Minister at 2.2, and then going on to match New Zealand, Canada at 5-6%. That is an important thing, and how you use that funding becomes important. So look, there were brilliant ideas around that framing, and the framing was, in particular in the area in the session that I chaired, framing around all of government, all of life, all of the different life stages of people. So I think what we see here is something for Labor to seriously think about. They've tapped into so many brilliant minds and so much knowledge, so much research. I just hope they use it really well.
And how will we know that they are doing that? How will we know that it's heading that way?
Well, first of all, I expect that we'll begin to see it filtering through into parliamentary inquiries and reports. I think we'll see them even in the next little while before there's a change of government, in giving ideas, putting ideas out there, and hoping actually that government will adopt them. And Bill Shorten certainly indicated that in the area of health he's happy for these ideas to be stolen in his terms. That would be brilliant, but then the most important thing is we want them in Labor Party policy going into the next election, and then we can hold them accountable.
I have a cynical question, which is fair to put to you as a former politician, but he said he's happy if people steal them, but in actual fact, because Labor did so well on health in that last election, do you think there is a risk actually that they won't try and make good health stuff happen in the meantime? Is it in their interest not to?
In one sense, politically, it is in their interest, but the irony is it's actually in the interest of the new Health Minister, Greg Hunt, to step straight into Labor territory. And it's not as though this today was particularly secretive. Have a look at all the tweets through Croaky or anywhere else, and they can hook on to the ALP Health Summit hashtag and find out all the information. Well, Greg Hunt, step into Labor territory. That's you've got that choice, and actually it'll improve your chances in the next election. I don't mind, provided the health issues are implemented. That's what we want.
And that's a reminder that we actually Labor isn't in government, so today was very much a theoretical exercise, really. Have you had a meeting with Greg Hunt yet?
I've spoken to him a number of times and had a meeting with him, and you know, it hasn't been his area. He's not been there very long. He's taking an intelligent approach. He's listening, and so I have some hope that we'll see some interesting things. He is working within a government that has a very strong backbone of Conservatives, so there'll be some great challenges for him. But we've got two things I think going for us in health. He's intelligent, he's trying to understand what's going on, and he's quite powerful in cabinet. You know, the best health ministers have always been powerful in cabinet, and I think of Nicola Roxon, I think of Michael Wooldridge. These were really top health ministers. They were powerful in cabinet.
If he moves in areas that you have a big stake in, where do you think he's most likely to move?
Look, I think that it's not just him. I certainly hear that the Prime Minister is also interested in prevention. They recognise that our obesity problem in particular, I can think of a number of others, but they recognise that our obesity problem in Australia is going to bring long-term major expenses for governments around Australia, particularly in the hospital system, but in the PBS and the MBS and so forth. And I think they are serious about wanting to intervene. Now, can they be strong enough to do it in the face of the sorts of things that we need in terms of restrictions on marketing and interfering with industry? And
you're talking sugar tax, you're talking alcohol tax.
And look, I don't see them implementing either sugar and alcohol tax, but there's lots of other things they can do. I mean, I'd love them to, don't mistake me, but there are a lot of other things they can do.
Tell them
and let's start priority one with restriction on marketing of junk food to children, restrictions on this free-to-air marketing around sport, where alcohol is allowed to advertise because of the sports, and junk food's allowed to advertise to children. It's a good starting point. Get rid of it.
Okay. Thank you very much.
No worries.